Good morning, Mr. Koo. I am Ryan and I will be your facilitator for today.
Okay.
I will be assessing your cardiorespiratory fitness and balance. You will be doing 3 tests today. One is to test your cardiorespiratory fitness and the other 2 is to test your balance. For the balance assessment, one is to measure your static balance and the other is to measure dynamic balance. To test your cardiorespiratory fitness, I have picked out the 2 km UKK walk test. To test your static balance, I have picked out the stop test. And to measure your dynamic balance, you will be doing the star excursion balance test. Before we start, I will be conducting pre-participation screening.
Okay.
I will be asking you a series of questions. Please answer them honestly,
Okay.
because this concerns your safety. Okay, so why are we doing this pre-participation screening? It is to identify individuals who should receive medical clearance before starting exercise or increasing volume or intensity of training. Or is to identify individuals with clinically significant diseases who should participate in medically supervised exercise programs. Or is to identify people with medical conditions requiring exclusion from exercise programs until conditions ease or are better controlled. Okay, so now I'm going to ask you a few questions.
Okay.
Do you experience chest discomfort with exercise?
No.
Do you experience unreasonable breathlessness?
No.
Do you experience dizziness, fainting or blackouts?
No.
Do you experience ankle swelling?
No.
Do you experience unpleasant awareness of a forceful, rapid or irregular heartbeat?
No. I don't.
Do you experience burning or cramping sensations in your lower legs when walking short distance?
No.
Have you performed planned, structured physical activity for at least 30 minutes at moderate intensity on at least 3 days per week for the last 3 months?
Yes. I have.
Have you had or currently have a heart attack?
No. I don't.
Heart surgery, cardiac catheterization or coronary angioplasty?
No.
Do you have a pacemaker or implantable cardiac defibrillator or rhythm disturbance?
No.
Heart valve disease,
No.
heart failure,
No.
heart transplant,
No.
congenital heart disease,
No.
diabetes
No.
or renal disease?
Don't have.
Do you have any known cardiovascular, metabolic or renal diseases?
No.
Do you have pain or discomfort or any angina equivalent in the chest, jaw, arms or other areas that may be due to myocardial ischemia?
No.
Okay, in case you are wondering, angina is chest pain or pressure, and myocardial ischemia is condition of weakened heart muscles due to heart attack or coronary heart disease.
Okay.
Okay. Do you have shortness of breath at rest or with mild exertion?
No. Don't.
Dizziness?
No.
Do you have syncope, which is fainting resulting from certain stressful triggers which lead to sudden drop in blood pressure and heart rate?
No.
Okay. Autopnea, which is difficulty in breathing while lying down.
No.
Paroxysmal nocturnal dyspnea, which is attack of severe shortness of breath and coughing that generally occurs at night.
No. No.
Ankle edema, which is swelling that develops from excess fluid in the body tissues.
No.
Palpitations, which is feelings of having a fast beating, fluttering or pounding heart.
No.
Tachycardia, which is heart rhythm disorder with heartbeats faster than usual, greater than 100 beats per minute.
No.
intermittent claudication, muscle pain during exercise.
No. Yeah.
Known heart murmur, which is whooshing or swishing that your heart makes when blood flows abnormally over the valves.
No.
Unusual fatigue or shortness of breath with usual activities.
No.
What is your desired exercise intensity? Light, moderate, or vigorous?
Moderate.
Seeing that you already exercise regularly, have no cardiovascular, metabolic, or renal diseases, and show no signs or symptoms of any of the above diseases, medical clearance is not necessary. You can continue your current exercise volume and intensity and progress as appropriate.
Okay.
Your cardiorespiratory fitness and balance assessments will be done in 2 days from now. Please take note of the following. Do not exercise on test day.
Okay.
Within 3 hours of testing, do not consume alcohol, caffeine, food, and tobacco.
Okay.
The attire for the assessments is clothing that permits freedom of movement. Wear walking or running shoes. Please drink ample fluids over the 24-hour period preceding the test to ensure normal hydration before testing.
Okay.
Are you taking any medications?
No.
You may wish to have someone accompany you to the assessment to drive you home afterwards.
Okay.